cardio-metabolic nutrition outcomes.
Good morning, everybody. Thank you, organizer, for having me here. So the topic is Edentulous versus Dentulous elderly, its impact on cardiometabolic nutrition outcome. We will see what is Edentulous, how it impacts our nutritional intake, how this nutritional intake leads to cardiometabolic disorder. We will also see biological mechanism, rehabilitation outcome, clinical and public health implication. So, according to WHO, elderly population is increasing globally, and prevalence of edentulism is also increasing among elderly, that is more than 60 years of age, and it is commonly seen in low socioeconomic status and which is associated with the chronic diseases. So what is edentulism? Edentulism means complete loss of natural teeth, and dentulous means presence of natural teeth. According to WHO, presence of 20 teeth or more than 20 teeth, natural teeth, are considered as functionally adequate. So what happens when there is complete loss of natural teeth, that is edentulism, the masticatory efficiency of the patient gets reduced. That means they are unable to chew their food properly, and because of this there is dietary modification. That means they avoid raw fruits and vegetables, they avoid nuts and seed, and instead of that they prefer more of soft diet, more of processed food, and more of saturated fat. And because of this there is dietary diversity, reduce in dietary diversity. There are many studies which are showing the similar studies, and among this the first one is our study. This is our study. We have done comparative evaluation of nutritional status of dentulous and edentulous patient. We took two groups. One group, they were having 20 or more than 20 natural teeth. The other group's complete loss of teeth, they were edentulous patient. We did the nutritional evaluation of both the group, and we found the same finding that only 62% of edentulous patients were taking fruits and vegetables against 88% of dentulous patients, and only 36% of edentulous patients were taking nuts and seed against 54% of dentulous subject. And in this, the edentulous patient which were taking fruits and vegetables, they were consuming in the form of juices. That means there was reduced in fiber intake. Okay, so this is our study which was published in Indian Journal of Community Health by AIMS Hospital, Delhi in 2014. And what happened? Because of this dietary diversity directly impact on macro and micronutrient. In macronutrient, there is reduction in the protein intake, there is reduction in the fiber, and increase in refined carb, simple processed food, and increase in saturated fat. Similarly, it also affects the micronutrients like vitamin C, folate, as they are avoiding fruits and vegetables, but obvious there is reduction in all these vitamins and minerals. And you know that these vitamins and minerals are very much important for the vascular health and immunity of the patient. So this all nutrients are protective nutrients. Dietary fibers which we get from whole grains, fruits, vegetables, legumes, and this is very important to control glycemic index, and it also helps to reduce the lipid profile. Omega-3 fatty acids which we get from nuts and seed, this help us to reduce inflammation and triglycerides. Antioxidants like vitamin C, polyphenol E, this help us to reduce oxidative stress in the body, and this oxidative stress is major cause of all cardiovascular diseases. Plant-based food that is rich in phytochemicals and fibers, these are also very important nutrients for management of cardiovascular diseases. When there is reduce in masticatory efficiency, there is dietary modification, and because of this there is reduction in all this protective nutrient, and because of that what happened, it directly impact the body composition leading to sarcopenic obesity. That means increase in fat mass and reduction in the skeletal muscle mass. And this leads to metabolic syndrome, that is central obesity, hyperglycemia, hypertension and dyslipidemia. Now we will see how edentulism and diabetes are linked. They carry bidirectional relationship. That means diabetes leads to periodontal diseases and periodontal disease leads to diabetes. So this is a pathway showing that how edentulism leads to diabetes. When the periodontal pathogen enters bloodstream, it releases the pro-inflammatory cytokinase, which leads to insulin resistance, beta cell damage and ultimately diabetes. Periodontal diseases are affected both systemically and locally. The person who is suffering from diabetes, that is hyperglycemia, leading to increase in intracellular oxidative stress, and this oxidative stress is a major cause of endothelial dysfunction. And in state of obesity and insulin resistance, this oxidative stress increase the systemic inflammation, which is major cause of endothelial dysfunction. In this way, periodontal diseases are affected systemically. And at the local level, periodontal diseases are affected, their diet plays major role. Okay? At the local level, diet can be both beneficial and they can be harmful. That means if you are taking harmful nutrients, it will lead to, that means reduction in the fiber, reduction in the all antioxidant, then there will be increase in the it leads to hyperglycemia, and this hyperglycemia will increase oxidative stress leading to periodontal diseases. But on the contrary, if you take beneficial nutrient like high fiber food, low processed food and more of protein food, then it will help you to control the blood sugar level, and this in return will help you to reduce the oxidative stress, and it will help to prevent periodontal diseases. So this way periodontal diseases are affected both systemically and locally. Now we will see how edentulous, that is complete loss of tooth, is related to cardiovascular diseases. The pathology is same. The periodontal pathogen enters bloodstream, it releases cytokinase. This leads to increase in oxidative stress leading to atherosclerosis formation, and this is the major cause for all cardiovascular disease, that is coronary artery disease, hypertension, stroke, etc. There are many studies which shows that tooth loss is a risk factor for cardiovascular disease mortality. This is a meta-analysis of the studies linking tooth loss and coronary artery disease. Altogether, this evidence says that being edentulous or having lesser than 10 teeth is predictive indicator of cardiovascular disease. Dental status may serve as a simple, non-invasive clinical marker of cardiovascular disease burden. Extensive tooth loss is strongly associated with heart failure among MI patients, suggesting a potential link between oral health deterioration and adverse cardiac remodeling. This is very important. Integrating dental assessment into cardiovascular care may enhance risk stratification and promote holistic prevention strategies. So what physician should do? Physician can highlight the importance of oral health as part of comprehensive disease prevention program, include oral screening in all geriatric patients, and they should refer the patient for denture rehabilitation. When they send for denture rehabilitation, they must send the patient to the dentist. What dentist will do? They will give them conventional denture. They will fix the denture with the help of implant. And what this will do? This will improve their masticatory efficiency. Their chewing capacity will improve, and hence the intake of diet will also improve. The micro and micronutrients which are affected, it will help to improve the intake of all the helpful nutrients. So role of dietitian. Dietitian in routine practice just take history of other parameters like blood parameters, BMI, lipid profile and so on. But this is a blind spot for us that we don't take the dental history. We don't know the patient chewing efficiency. But now, as we have seen so far that tooth loss is important indicator for cardiovascular disease and our diet advice should compensate this limitation as far as possible. So prevention is always better than cure. Dental screening will definitely help you to prevent the risk factor related to cardiovascular diseases, and policy level integrations will definitely help you to reduce the costs related to cardiovascular disease management. So future research, we need longitudinal mechanistic study, interventional dental trials, biomarker based risk prediction. We need prospective cohort study that simultaneously evaluate oral health, dietary intake, inflammatory biomarker, endothelial function and cardiometabolic outcome over time. Randomized control trials should assess whether denture rehabilitations reduces CRP, lipid profile, HbA1c or lower incidence metabolic syndrome. Integrating oral health variable into cardiometabolic risk prediction model could improve early detection. We must evaluate whether integrating oral screening into the geriatric and cardiovascular disease clinic reduces healthcare cost and cardiometabolic morbidity. So the take-home message is that when there is complete loss of tooth, there is reduction in the masticatory efficiency. This leads to dietary modification and it impacts on macro and micronutrients, leading to inflammation in the body, and this causes cardiometabolic disorder. So as a medical practitioner and dietitian, we should be aware about this tooth loss on systemic, how tooth loss is affected the systemic health. We must plan our treatment accordingly. Nutrition is the key modifiable factor in managing cardiometabolic health, and edentulism significantly impact nutritional intake. This is the missing link in treating cardiometabolic disorder. So what I suggest, whether physician, initially everybody were practicing individually, whether it was cardiologist, diabetologist or urologist. But now they have come together, they have doing a teamwork, and later on they came to know that these diseases are lifestyle diseases, and so they include dietitian in their clinic. But now this is a missing link, and I advise everybody to send your patient for the dental screening. As my husband is a dentist and prosthodontic, and so I am promoting my husband as a dentist, that every clinic should have a dentist. Thank you so much. Any questions? No, it is a missing link. No cardiologist, no endocrinologist have dentist in their clinic. But what I suggest that it is a preventive indicator for a CVD. Yeah, and diet is also affected because of denture. So diet is a, yeah, so that's why early screening is very important. If you can save the tooth, that is more beneficial. So early screening of oral health, because oral health is highly neglected. Previously diet was also neglected, but I always say my patient, remember D square, that is diet and dental. But it is expensive initially, but later on it will save your healthcare. Huh? Yeah, now they have started, I think, in most of the cases. Yeah, 50K, yeah. Yeah, single tooth is 25 to 50. How you are taking the depends on the teeth, quality of the teeth, and color of the teeth. How it is near to your original teeth. Even I have seen you don't. Yeah, depends on your age. If you are having more problem, then 6 monthly checkup is it. Even a single bleeding gum is very risk factor for CVD, and that is more neglected. People keep on this thing neglecting it, and this leads to forming gap between the tooth and the socket of the teeth. And when it becomes loose, then times comes to remove the tooth. So this is the slow process. So initially only when the patient comes first, you should also screen for the oral health. Any small inflammation in the oral, that will enters, the pathogen will directly enter into your bloodstream, leading to increase in the oxidative stress. Yeah, yeah. But that is the most neglected part, and I think this should, everybody should encourage having doing oral screening. Yeah, yeah. Thank you so much. Yeah. Yes, there are many studies which are indicating that edentulous leads to cardiovascular diseases. You can do, you can just enter edentulous and cardiovascular. You will get many international bodies which are considering this factor. Even our Varanasi declaration have oral health, and they have mentioned there in their book. Yeah. Yeah.